This is a scanogram of a patient who presents with acute respiratory distress, and a CT scan was done. So this is a scanner of that CT. And now I will browse through the images of HRCT of the same patient. And these are the coronal images of the same patient. So now as I browse through the images, the first thing you might have noticed is that there is relative hyperinflation of the left lung as compared to the right lung. If I compare, it's more lucent as well as is showing increased volume as compared to the contralateral right side. And also there is, if you can just observe at this level, there is also contralateral shift of the mediastinum as well. Now, so the differentials of a patient who is presenting with hyperinflation of unilateral lung in a, if it's a child, so the first differential which should come to your mind is going to be a foreign body. So what we are going to do is now follow this trachea, and as we follow it down, you can just see it's going to be bifurcation of the trachea at the carina. This is the left mainstem bronchus. This is the right mainstem bronchus. For the time being, just focus on the right side, and you can just see it's pretty much clearly demarcated and with no obstruction. But now as I come to the left side, the left mainstem bronchus just gets occluded completely after a short length, and then you can see that these bronchi are extending up to the hilar region. So this raises a suspicious of a foreign body, and so as now I've done some windowing on it, now you can see and follow the left mainstem bronchus, and you can see that there is an sort of relatively hypodense area in this region which is causing the obstruction. It is relatively hypodense as compared to the adjacent soft tissues, and if I do a attenuation measurement of it, so it's more around the minus 45 and 40 HU. This is a rendered image of the same patient, and if you can follow this trachea, and you can see that there is again a complete obstruction and occlusion at this level of the left mainstem bronchus, where the foreign body is impacted. There is also hyperinflation of the left lung, which in this case is because of the ball valve mechanism, where it permits the air trapping by permitting the inflow of the air, but no proper outflow of the air is possible on this left side, and which is resulting in expansion of the left lung. So this foreign body likely appears to be organic, and so a foreign body which is normally in the range of 0 to minus 50 could possibly be walnuts, peanuts, and pistachios, or could be some plastic as well. And on bronchoscopy, the patient foreign body was turned out to be a peanut, which was impacted and was retrieved, and patient recovered successfully. So this was a case review in a pediatric patient.